Nursing 431, Ethical Issues in Nursing Research. The course learning objectives for this week include articulate the role of nursing research within clinical practice and explore the components of the research process, recognize the value and relevance of research in nursing to the development of one's own professional practice and to the quality of patient care, and number 7, demonstrate ethical practice in nursing research. The weekly learning objectives include identify sources of nursing knowledge, which we discussed in the last PowerPoint, discuss importance of nursing research and nursing practice, appreciate the role of institutional review boards, identify ethical guidelines for research, identify elements of informed consent, and recognize unethical research. In the 1940s, Germans performed many unethical studies on concentration camp prisoners, rationalizing that their victims were not real people. The United States was not immune to these unethical research practices, and with the Freedom of Information Act, their actions were made public. Unethical studies that took place in the United States performed atrocities on at-risk populations, exposing subjects to infectious diseases, testing experimental vaccines, and leaving diseases untreated. People have always been interested in the need for ethical guidelines to govern the actions of human beings. These rules change frequently with time and new knowledge. The atrocities that occurred during the 1940s resulted in the establishment of the 1947 Nuremberg Code, identifying ethical standards for research. Many other ethical codes quickly followed to protect human beings from unethical situations. The Health Insurance Portability and Accountability Act, otherwise known as HIPAA, protects an individual's health information. In 1968, the American Nurses Association Research and Studies Commission published a set of guidelines for nursing research. So the Nuremberg Code in 1947, the guidelines include researcher must inform subjects, the research must be for the good of the society, research must be based on animal experiments, researcher must avoid injury to subjects, researcher must be qualified to do the research, and subjects or researcher can stop study if problems occur. Other ethical codes include the Universal Declaration of Human Rights in 1948, the Declaration of Helsinki in 1964, the Belmont Report in 1979, which included respect for persons, beneficence, and justice, and the Department of Health and Human Services, DHHS. Research guidelines for nurses include human rights guidelines for nurses in clinical and other research. It was originally 1975 and then revised in 1985. It protects subjects from harm, ensures privacy, preserves subjects' dignity, and keeps nurses fully informed. Also, the ethical guidelines in conduct, dissemination, and implementation of nursing research by Silva in 1995 stresses research integrity and reporting of scientific misconduct. The federal government, DHHS, established institutional review boards, IRBs, to review all research proposals of agencies and institutions receiving federal money. There are many IRBs, and research performed by nurses may fall under the jurisdiction of a variety of agencies. What we need to know is that there are nursing research committees. Policies may vary from agency to agency. You need to be informed about the institution's specific requirements and also be aware that permission to conduct research can take time. So you need to plan ahead. The The principal way of ensuring the rights of nursing research subjects are protected is through informed consent. There are 12 major elements that need to be addressed in informed consent. Researchers must identify themselves, their qualifications, and their sponsoring agency. Subjects must be made aware of the process which they were selected to participate in the study, whether it was by random selection or by processing certain criteria. Researchers must clearly present the purpose of the study, providing enough information for subjects to feel confident giving their consent to participate. Subjects must understand the study procedure, including place, time commitment, and format. If information is withheld, the researcher must debrief the subject following participation. Subjects must be told of any possible discomforts or invasions of privacy, identifying any and all risks that might influence the subject's decision to participate. The Nuremberg Code states that all research must be for the good of society. Therefore, subjects should be made aware of potential benefits to those involved in the study as well as to others. Monies or other types of compensation should be described to potential subjects. Researchers must explain alternative procedures or treatments to participants. If a study is not anonymous, confidentiality must be ensured by the deletion of any identifying information that would allow subject identification. Subjects must voluntarily agree to participate in the study and have the right to withdraw for any reason without penalty. Potential subjects must be given the opportunity to ask questions about the study, and the researcher should be available to provide answers both at the time of the informed consent and after. The researcher's publication plans and desires must be indicated, and the subjects should be given the opportunity to obtain the study results. The Office of Research Integrity, ORI, in the Department of Health and Human Services investigates cases suspected of misconduct by researchers who have federal funding. Nurse researchers need to be especially attentive to instances of coercion, deceptive language on informed consent forms, falsification of documents, and conflicts of interest. Nurses need to act as patient advocate during research investigation. The researcher must protect the privacy and dignity of all subjects. The researcher must assume responsibility for study conditions and protect the subjects from physical or psychological harm. The researcher must be aware of subjects who are vulnerable, either because they are unable to give informed consent or because the likelihood of coercion is strong. So, examples of vulnerable populations include children, geriatric clients, prisoners, homeless, AIDS patients, unconscious individuals, sedated individuals, and assent considerations. Although most published research devotes little space to subjects' rights, readers of a report must be able to make some determination about the ethical nature of the study. So guidelines for critiquing ethical aspects of the study include: was the study approved by the IRB? Was informed consent obtained? Were provisions for anonymity and confidentially provided? Were the subjects vulnerable? Was there coercion? Did the benefits outweigh the risks? Were the subjects given the opportunity to ask questions? And were the results made available to the subjects?